They represent the third largest nationality in the NHS. 30,000 people from the Philippines are frontline health workers. Many Filipinos came to Britain in recruitment drives, yet they feel invisible and believe their contribution goes unrecognised. And it seems that, like other ethnic minorities, they've been disproportionately represented in pandemic deaths.
She came here to try to look for a new opportunity. We were doing fine in the Philippines, but she wanted a better life for us. She's been working as a nurse for 20 years. That's all her life, caring for other people.
Joseph lost his mother to COVID. Louisa Rial had been a nurse in London hospitals for 2 decades. She also ran a dessert business. Her son is now trying to keep her memory alive by continuing it.
Every time I remember her smiling, looking at me, I can see her eyes is happy when she sees me do the desserts.
Last summer, Louisa was diagnosed with motor neurone disease and had to stop work. She later ended up in Newham Hospital on 2 occasions. In January, she tested positive for COVID, but was released from the hospital. She died at home the next day.
We spoke to the doctor. They called us. They told us that we have to release your mom because we don't have enough bed space and running out of oxygen.
The family say Louisa gave so much to the NHS, but when she needed it herself, she was let down, and their complaints were ignored.
I feel like I'm not sure if there's a discrimination there or something, but they wouldn't really focus on us like.
Barts Health NHS Trust told us the safety and welfare of their patients is their top priority, and that they're currently investigating the concerns raised by Louisa's family. Filipinos aren't recognised as a separate ethnic group in Britain, which makes it almost impossible to calculate the extent to which they're being disproportionately affected by COVID. Community group Canlugan wants this to change, and they've compiled their own figures which they've shared with this programme. They suggest at least 70 Filipino health and care workers have died after contracting COVID in the UK.
Many of those actually who were assigned in these COVID wards are just new nurses. Imagine just coming here for like a few months before the pandemic hit, and they were immediately deployed in these COVID wards. And so they feel like they don't have the right to question that because they have to prove themselves that they can do the job.
They believe discrimination is a factor in why Filipino NHS workers appear to have been more exposed to COVID.
Filipinos came here to work. They have families to support, and they feel like they would have to do everything, and that includes working even extra hour just to do that. Somehow they are being taken advantage because, for one, they're also the ones working in low-paid job, low-grade job.
A government spokesperson told us they are hugely grateful to Filipinos in our NHS working tirelessly on the front line. The Department of Health accepts there's clear evidence COVID disproportionately impacts certain groups and say they're doing everything they can to minimise the risk to ethnic minority NHS frontline staff. For those who have already lost loved ones, it's a struggle, not just emotionally but financially.
Ang ate ko kasi mapagmahal siya sa aming magulang. Gusto niya hindi maghihirap yung magulang namin na kasi galing kami sa mahirap na pamilya. Farmer yung tatay ko, kaya nagpursigi siyang makapunta dyan sa UK para makapagtrabaho at maiangat ang aming pamilya.
Noel's sister Leilani Medel was a nurse in Bridgend. She died of COVID in intensive care in April last year. Like many Filipinos, her family in the Philippines was reliant on her for support.
Halos breadwinner siya din sa amin, sa pamilya namin. And then hindi naman sapat yung trabaho ko na dito sa Philippines para suportahan din yung parents ko. Yung nagbibigay ng allowance sa amin sa parents ko.
For many Filipinos, working abroad is a necessity, but some say they're being treated like commodities. The government of the Philippines even recently offered to exchange nurses for vaccines, an offer the UK government has turned down. Most Filipinos working in the NHS say they're proud to do so. They just want more recognition. Jericho and Christina are both nurses, and they both ended up contracting COVID at the same time.
The patient started to experience symptoms of COVID, and we were just wearing a simple mask, not really a COVID gear. And then one by one, all of us turned to have symptoms.
I ended up having fever for up to 10 days, as high as 39 to 40.
They would like Filipinos in the UK to be better empowered and feel they're able to speak up for their rights.
We Filipinos are not that assertive in terms of their rights. Most likely, we are grateful recipients. Actually, we were thinking to move in the US because we believe that Filipinos are more recognized in the healthcare rather than here in the UK. Sadly, that's the situation. If we're talking about support and trying to speak up and being assertive, yeah, that starts with the recognition as being a Filipino, isn't it?
It would be nice to be recognized and acknowledged, but not just in NHS, I suppose, as members of the community, I think.
Many Filipinos in the UK are hoping the sacrifices they've made in the pandemic will lead to their community being better recognised and valued.